some of the introductions for today. We've got an hour booked out for the webinar. It may take less time than that, depending if you've got any questions. So if you can see me on screen now, I'm Mike Bailey, Career Progression Programme Manager, and I'm joined by Rob, next to me, Rob Smith, Excellence Centre Coordinator for National Skills Academy for Health. Yeah. And then also on my right-hand side, kindly, we've got Fiona Anderson, who's Apprenticeship Lead and Work Experience Manager for Kent and Medway NHS and Social Care Partnership Trust. So the way we're going to do it today is I just always give you a bit of a background on where we are at and what some of the drivers are behind the apprenticeship initiatives. Then I'm going to hand over to Rob, who's going to give us a bit of an oversight about the apprenticeship agenda and actually developing apprenticeships and what's available at the moment as well. So you've got that, you've got all that information. As we go through, feel free to ask any questions that you have, and we'll endeavour to answer them as much as we can do. And then after that, I'm going to hand over to Fiona, who's kind of going to talk us through her experiences in the trust and actually how she's developed apprenticeship schemes and initiatives. So, and again, if you want to ask any questions during that, please feel free to do so as we go through. So I hope that's all right with everybody.
Yeah, that's fine.
Great.
Fine.
Okay, so obviously just to set the scene, I'm sure you're all really aware of this, but apprenticeships are a Department of Health and Health Education England priority. We've got them on the Health Education mandate to deliver them, and the Department of Health, as I'm sure you're aware, has been tasked with actually introducing 25,000 new apprenticeships over this last year and this coming year. So that's for new and existing members of staff going on an apprenticeship framework. All the major political parties have this as a priority. Obviously, I put that in there because we're still counting, aren't we, today? So, and really, the reason behind apprenticeships, there's a lot of evidence out there about the benefit of apprenticeships and the benefits of bringing them into your workforce and building your workforce for the future, because we know there's a range of issues out there around workforce, and apprenticeships could be just one of the options on the table to help bridge that gap and actually bridge some of those issues in the workforce. A lot is about getting young people into health and social care careers via apprenticeships, but also as well, it goes beyond that, because an apprentice doesn't necessarily need to be a young person. They could come from a variety of different age groups. And really a lot about it is, if you're thinking about things that we're looking at the moment, like the need to recruit externally and overseas for nurses, what we're looking to do is, can we do anything around apprenticeships that would enable a homegrown workforce to actually, again, bridge some of those gaps? And as I'm sure you're aware, we had 551 new apprentice starts in 14-15 across Kent, Surrey and Sussex, and the target for this year is not unachievable, 1,373 apprentice starts. And again, that's people going on to an apprenticeship framework, whether it be a new member of staff coming in and going on an apprenticeship framework, or whether it be an existing member of staff that you put on them on an apprenticeship framework as part of their continual professional development. It covers clinical and non-clinical, and Rob will go through that in a bit further detail. Today we are going to concentrate more on about bringing new people into your organisation and not so much on the existing members and staff, because we think a lot of organisations already have that up and come and talk to us about those sort of areas. And really it's to try and highlight with people, can you start to raise and build into your workforce plans apprenticeships? Do they have a place in there? How may they fit in there? And again, we'll be doing with some of our workforce analysts here through Richard Lee Wright, we'll be starting to look at a piece of work about how you might actually do that as well. So, does anybody have any questions on that? Okay, no problem. What I'm going to do now is I'm going to hand over to Rob to actually talk you through what's actually happening around apprenticeships.
Lots of people have joined now. I don't know if you want to.
Okay, we'll just get the slides up. Can everyone hear me?
Yeah.
Good. That was at least one yes. Okay, so yeah, as Mike says, I'm here today to talk about, to concentrate on how to bring new people into your organisation on apprenticeships. First of all, I thought I'd start by just explaining exactly what an apprenticeship is. As I say, this webinar really is aimed at people who are new to this area, perhaps from HR, who want to find out about bringing in apprentices into their organisation. So there are 3 levels of apprenticeships available. There's the intermediate, the advanced, and then the higher apprenticeships. And all apprenticeships have 5 main components. So that is the certificate or diploma in vocational skills. So that's the NVQ. That's the competence qualification that many of you will be used to, what staff have done previously with standalone NVQs. But there's also a technical certificate, which is a classroom element. It's the taught element that gives the underpinning knowledge, the why do you do what do you do. So not just that you're competent in your role, but you also understand why you do your role and how you may improve your role. To go alongside that, there's a couple of qualifications around employer rights and responsibilities, and personal learning and thinking. And then, very importantly, in the apprenticeship framework, we also have the functional skills. So that would be the maths and the English, and in some cases IT. So that's what makes up the framework of an apprenticeship. So it's an amount of qualifications together that make an apprenticeship framework. So generally they take between 12 to 18 months. The minimum time for an apprenticeship is 12 months, be that a level 2, 3 or higher, any higher apprenticeships. And it really depends on the experience of the apprentice as to how long the apprenticeship may take. So someone who comes in at a very young age, in a new position, in a new role, it would take probably longer, obviously, than someone who's perhaps coming in after working in a similar organisation or a similar role for a couple of years. So it really depends on the person. So all so all apprentices, say they spend the majority of the time in the workplace. It's very much a workplace qualification, but they will also go off-site to attend training sessions. When I say off-site, that may mean into a college, but it could equally mean into one of your training rooms where the training provider or college comes into your organisation to deliver the off-site training. So there will be a time commitment for away from work training, and that will depend on the needs of the apprentice, but that will be discussed with the apprentice and the manager by the college to work out the programme right at the beginning. I thought I'd just go through the massive range of apprenticeships that are available in the health sector. As it says there, I mean, Skills for Health have identified over 100 jobs that could be linked to an apprenticeship, and there's over 80 frameworks to choose from. And I've just picked out for today a few of the clinical and non-clinical ones. So you can see there a list of the clinical apprenticeship frameworks, and I'll just run through them very quickly. We've got health and social care, clinical healthcare support, AHP, healthcare support services, so that would be for porters and housekeepers. There's maternity and paediatric, emergency care, dental nursing, pathology, perioperative, pharmacy, blood donor and optical. So they're all the current health frameworks that would hopefully cover pretty much anyone in a bands 1 to 4 position working in a clinical role. But there's also a large amount of non-clinical ones. I've just picked out a few because there are many. But the thinking really is that there shouldn't really be a role in bands 1 to 4 where there's not an apprenticeship framework that is suitable. There may be a couple of specialist areas, but generally that should be the case. So I've listed a few there: business administration, customer service, contact centre operations, there's engineering, bookkeeping, library services, payroll, plumbing, heating, hospitality, facilities management, professional cookery, many, many more. So just to give you an idea that there should be an apprenticeship framework for every member of staff or every bands 1 to 4 vacancy you have. So I want to talk about how you actually employ an apprentice in your organisation. And there's 2 ways really, and the first one would be when you have a vacancy of a substantive post. Would you consider that role for an apprenticeship? Could there be a policy in your organisation where all band 2 vacancies, for example, are considered as an apprenticeship? Not necessarily that they have to be an apprenticeship, but that the manager needs to consider them as an apprenticeship and perhaps fill out information as to why they believe it not to be suitable at that time. That would then give information to work on for the future about how we may improve the chances of getting apprentices in by working with the barriers that managers feel. So that's one way, through filling a substantive post. And another way could be through a supernumerary fixed-term contract, where you bring an apprentice in on a, let's say, a 1-year fixed-term contract for the duration of their apprenticeship, where they'll be employed by you on the fixed term, or if you prefer, they could be employed by our National Skills Academy for Health Apprenticeship Training Agency, where we would take on the employment responsibility of the apprentice, and they'd work on placement with you for the term of their apprenticeship. We would pay them via yourselves, and if anyone wants to talk about that in more detail, I can certainly talk to you independently about that at another date. Couldn't really do this without pointing out some benefits of apprenticeships. So there's a big long list that I've got here, but some of the main ones really are: it's obviously a great way of growing a sustainable pool of trained and motivated staff within both clinical and non-clinical roles. It's a great way of promoting NHS career opportunities, and helps with recruitment and retention. Allows you to develop skills and competencies of staff around current and future patient and service need. Develops a flexible, responsive workforce, and there's many on there that hopefully you can also see. I won't go into too much detail, otherwise I'll be reading all my slides out. But these slides, by the way, will be coming out available on email afterwards as well. So to move on about the costs of apprenticeships, so the actual cost of the training of the delivery, i.e. what the college or training provider will charge you, can vary greatly. So one area where it shouldn't vary is if your apprentice is 16 to 18 years old. In that circumstance, it's always fully funded by government via the Skills Funding Agency. That's certainly true at the moment. That may change in the future when the new funding policies come in 2017, but certainly for the moment, all 16 to 18 year olds should be fully funded. If a training provider or college is trying to charge you for a 16 to 18 year old, have a word with them or come and tell me, and we'll take it up. If they're 19 or older, then there's always expected to be some employer contributions, especially from large employers like most of us are. However, again, that varies greatly between different colleges and different training providers. And certainly on the non-clinical frameworks, the really popular ones like business administration, team leading, management, we should be able to find you quality training providers who can deliver apprenticeships for all ages fully funded or very close to fully funded. Some of the more difficult or less used frameworks, for example, perhaps AHP support, they're more difficult to find fully funded, but we can still find them relatively well funded. And I'm here to help with that if you need help in finding colleges or training providers who fund strongly, shall we say. Wanted to talk also about apprenticeship salaries. There's a lot of conversations I think go on, especially with HR teams, about apprenticeship salaries, and I think everyone thinks, oh, you have to pay an apprentice £2.73 and it's not enough and all the rest of it. £2.73 does exist, but that's the minimum wage for an apprentice, just the minimum wage, the same as there's a minimum wage for all of us sitting here and all of you listening, and I would suggest that none of us are on our minimum wages. So I think it really there is just to protect apprentices. I think we'd all probably agree that £2.73 an hour isn't enough, but what you choose to pay really is dependent on your business and what works for you. Obviously you need to look at, if you're filling a Band 2 post, for example, what would you pay someone who comes in with experience on a Band 2 post, and then look at how you would need to obviously make a cost savings bringing an apprentice in because you're going to need to support and train them. So you need to show obviously a reduction in the salary, but I would suggest not as low as £2.73 an hour. I think the base of a Band 2 is about £14,000, so perhaps a salary of about £7,000, £8,000, £9,000, £10,000 would be a suitable wage for an apprentice who you're going to have to support. As I say, that's really down to you as your organisation to decide where you fall on that. And there are equally plenty of apprentices on £2.73 an hour, but I would say it's becoming more and more difficult to get quality apprentices at that level. Also worth noting that from October this year, which is still a few months off, but it will quickly arise, the minimum wage for an apprentice is going up to £3.30 an hour. So if you are looking at what sort of policies you might set for a minimum wage, or sorry, for an apprenticeship wage, you need to bear that in mind. There is funding assistance available. Kent, Surrey and Health Education Kent, Surrey and Sussex are continuing to assist in funding apprenticeships, and the funding framework is the same as it was for last year, so that any 16 to 18 year old you sign up on an apprenticeship will receive, or you'll receive £500 as the employer. Same for any level 2 apprenticeship you sign up, that would also be £500 worth of funding, and for every level 3 or higher apprenticeship there's £1,000 worth of funding available from Health Education Kent, Surrey and Sussex. This funding is now available. There's enough funding to cover the target that Mike mentioned earlier, which is about 1,370 apprenticeships this year. We obviously would like to try and hit that target. If we go over that, we may run out of funding. So I would say that if you haven't given your demands in to myself or Mike, it would be good to get your demand in so we can put your funding to one side and allocate it out. So next steps, really I suppose there's plenty of support around this process. I'm here and I can help you support quality, cost-effective training if you require. You probably have your own colleges and training providers you use, and I'm not here to change that. But if you need any help and assistance in finding different frameworks or finding a better funded apprenticeship framework elsewhere, I can certainly assist you with that. At the National Skills Academy for Health, we have our list of delivery partners who we work with who have experience in delivering to the health sector and who are cost effective, so I can certainly help. But equally, I can also find you training partners and colleges who perhaps aren't part of our organisation but who are also very cost effective. The training provider will actually do a lot of support when you come to employing an apprentice. They'll work with you on the job description. If you supply them with a job description, they'll work up the advert that will go on the National Apprenticeship Service website. They'll also agree a training plan, with your apprentice, and they'll, through the website, recruit an apprentice for you. They'll sift applications if you wish, or equally you can see all the applications that come in, and then you would interview as you would normally. The training provider will also manage the training and evaluate the training as it goes along. And that's pretty much it from me. As my contact information is there for those of you who can see it. For those of you who can't, we'll send out the slides. And just wanted to check now whether there was any questions from my piece or back to Mike's piece.
No, I haven't got any.
Everyone still here?
Yep,
Great.
I'm still here.
I'll hand back to Mike, who will then explain where we're going next.
I think after today, if you've got any questions, then by all means, we're always available to be contacted and to, like Rob was saying, to help support you on these initiatives. What I'm going to do is now hand over to Fiona, who's going to give us a bit of her experiences about developing apprenticeship schemes within Kent and Medway NHS and Social Care Partnership Trust.
Hello. When I first started in the apprenticeship role, I hadn't actually got any experience of doing this. I was the work experience manager, which I still am, but it was sort of a natural progression to go on from there because of the work experience part of an apprenticeship role. So my first thoughts were, how am I going to start this? How am I going to get people interested? And this worked as well as from the community side to members of staff in my trust. So one of the first things I looked at is how can I get to an audience and tell them about the scheme and get them on board with actually having apprentices. So I had a meeting with the HR business partners. I went and saw our chief executive to get her thoughts on it. And I went to a lot of the department and team meetings to talk about the scheme, to get them interested, to see how people felt about having this in the trust and actually doing this. And then on the other side, of course, we needed to look at the local community and how to get them on board with it. So I attended careers fairs and events and went to schools and colleges, became a member of a website called Inspiring the Future, which you log yourself on as a volunteer and offer your services. So if something comes up, say for example a school want you to come and do a talk at a careers event, your name is there and then they will request you to come along and talk about it. And quite often I do talks on NHS careers, work experience, the apprentice scheme, to get the community on board, to get people know that we are doing this as a trust. So it's getting everybody engaged basically. Looking at the scheme and trying to decide what we want from it and how we're going to run it is quite difficult. We're a mental health trust, but we also have some specialist services. So in itself, we're spread across the county, so that's quite difficult because we've got about 70 trust sites. We've not got the one big acute hospital like a lot of the other trusts have. So that was something to consider. So it meant getting around to a lot of people. The best thing I found was putting a page on the intranet for our communications team on the internet so that staff could look and see, and then any event that's attended, advertise what you've done, case studies from apprentices that you have, if you put those on the website, see what other trusts, other departments will see what other departments are doing to get them on board. Go to the workforce committee, recruit and retention meetings, so that basically you can get the word out and get people interested. Then we had to look about documents. What are we going to do about documents? Because obviously they have to have some sort of agreement. So meetings with HR to talk about how we're going to do the apprentice agreement and what's going to be in it needed to be considered. Then also a policy for apprenticeships is another thing that you have to think about and how you're going to do it. The other thing as well is what learning provider to use, and I've used a variety. I do find myself that I've done well. There's one particular college that I work well with, and I like the fact that they have people in for assessment first and they shortlist, and they sent some really good candidates through. We've been very successful with them, but they, on the whole, they do charge for some of their services, where I've been also to an outside learning provider who don't have the college base, but they have most of their apprenticeships are free, so you need to look at that as well, because it depends on the funding that you've got to. So I've looked at some of those as well, up and down on those, but we found a few that have worked. So that's another thing to think about. What you require from the learning provider, how much you want them to do, and how to be involved with them, and you know what you're going to use as your assessment tools and things like that. We've had a few barriers and a few difficulties, but we've also had a lot of positivity. I've found that, especially the younger apprentices, they do need a lot of support. So basically what I try to do as the apprentice lead, I sit on the interview panel, I talk about the apprenticeship with them, make sure they're happy and understand how it's going to work. If they're recruited, I helped support them with the documentation and the paperwork that's involved, because as we all know, it's quite a wieldy process to actually be employed in the NHS, and sometimes it can be their first job, and they need a little bit more support when it comes to filling in the paperwork and actually starting in the trust with the process. Also, I sort of do say to them that I'm not your employer and I'm not the college. I'm someone they can come to as a third person, whereas if they've got problems, they can come along, talk to me as somebody individual outside of those fields, so that if they have any worries or any requests, that they've got someone to go to. I've been along, I've done email, phone, I've also visited apprentices if they have a problem to try and discuss and sort it out. So we do that, but we also do a 3-month review as well, just to make sure that they're happy and that all parties are happy. I also ask the training provider that they keep me in the loop when it comes to coursework and study, to make sure that none of the apprentices sort of get so behind and aren't coping and we don't know about it, because obviously as a trust we can support them. We've had successes, we've made apprentices substantive. We have also had problems, a few examples. Apprentices not turning up for work, sort of because they've come fresh from school or college, they don't have sometimes the commitment, they think that they can week in and out when they feel like it. We've had a few problems like that, getting them to the discipline of work and coming in at a certain time, going at a certain time, bits and pieces like that, I suppose. So we've also had one not happy with the department, so we've transferred her to a different department, which has worked quite well. sometimes we've had a problem where they can't complete their qualification in the time given. So we have extended the contract so they've got a little bit more time to get their coursework done, because bearing in mind they're working a full week and they've also got coursework to do. So, you know, we've got to consider that as well. But on the whole, it has been very successful. And I would say that it's really important that all parties are kept in the loop at all time. Talk to departments about apprenticeships, encourage more roles. Try not to stick to just business admin and health work. Look at the other departments and try and diversify the roles, and just decrease it from there. Okay, I think that's about it really. And if there's any questions.
I think what I'll just tie into that is just on to try and alleviate that problem as much as possible of individuals kind of not being right for the organisation or vice versa. Things like taster days are really useful to have, like that being built into there, which I know a lot of organisations already do. But it just enables you to see how they may work in practice, and if you could put some scenarios in there as well to make it as realistic as possible, it can be really helpful. So,
Yeah.
So, are there any questions for Fiona?
I've got one. Can you hear me? It's Dave here.
Yeah, no problem.
Perfect. I was just interested in kind of what you see the success rate of apprentices is in terms of dropouts or people that just didn't attend and things like that. So I've had previous experience of apprentices in the leisure industry, but have yet to see it how it works in health.
Yeah, I mean, we have had a varied degree. We've had some good successes where we've had people come and they've been made substantive after. We only offer a fixed term contract of a year or 18 months, but we have had successes where they've been taken on. We don't guarantee employment, so sometimes after the year we don't keep them on. They do go elsewhere, but they have gained years of work experience in the NHS, which I think is one of the most fundamental parts of it for them, gaining that experience. We have gone down the disciplinary line with one who didn't complete the coursework, therefore didn't meet the requirements of the learning provider, and obviously that has to go hand in hand. So it has been varied. As I say, a lot of support needed, especially with the younger ones. Some of them flourish, some of them find it such a different life from being at school or college that they do need a bit more support. So to me, I would say to try and make it successful, it is having somebody, not necessarily their mentor or their college provider, but someone who is there also overseeing and making sure that it's working for all parties is very important.
What was the success rate? Was it kind of 50-50 or?
I'd say a little bit higher than that actually. We've been quite lucky, and we have had quite a few made substantive, and if they haven't been, they've gone on and got work. So to me, that's, even if they're not with us, they've gained from it. We've only had sort of a few that have dropped out or decided it's not for them, or have gone on, and got something else. So we have been quite lucky, but having said that, our learning provider that we've used is very good, and they are always assessed before they come to us for interviews, so we know we've got good candidates coming along.
Can I ask who you've used?
Am I allowed to say?
Yeah.
Canterbury College. We've had a very good relationship with them.
Brilliant. That's good to know. Thank you. And I guess just a final question, it maybe for everyone else in the virtual room as well. Is anyone got any kind of selection documents or process that they're happy to share? In terms of rather than just a standard interviewing, because some of these people won't have had previous work experience. How have you gone about selecting them?
We actually.
If anyone's got any documents?
Yeah, we use our trust, vision, and values as questions, which are quite good. And we also do a maths and English test prior to interview, just so that we sort of get some idea. And that really is based again around the visions and values, and prepares them for interview actually, because they are the same questions. So they get a chance to look at the questions, write down their thoughts, and then they come to interview and they can expand on these. And we are really surprised, and I get a lot of staff saying they are surprised that people they interview generally don't answer the questions as well as some of the apprentices that come through. So it's really been very successful in that way, because they proved themselves at interview to the staff, which has really helped.
Another thing that's coming out nationally is in probably about a month's time is a values-based recruitment online assessment toolkit for bands 1 to 4 staff. So they can do scenarios online to give you an idea of their values, and their behaviours as well, and what they may translate like into the workplace. So we'll let you have that as soon as we get it.
Perfect. That sounds cool. Has anyone else in the room done anything different?
Hi, it's Julie. We've used a skills test when they've come for interviews, so we've asked them to copy type and do a couple of sort of admin procedures, and also just a quiz around their knowledge around the computer packages, which was really quite helpful to with the interview process.
Thanks, Julie. I'll drop you an email.
And I think from today what we can do is we can send you around some information as well, and any other good practice that we know.
Perfect. Thank you. Thanks a lot.
Any other questions? No? Okay, then, well, you just remains for us to say, what we'll do is we'll get the presentation out for you today. We'll also, as well, if we've got any other good practice around, we'll get that forwarded to you as well. A big thank you to Fiona and Rob today for being involved in the actual webinar. And also, as well, we'll put a copy of this online as well. But again, if you've got any queries or questions, please come back to us. Thank you.
Thank you very much.
Thank you.
Thank you.
Thanks.
Thank you.
Bye. Thank you. Bye-bye.
Bye.
Bye.
Yeah, no, it's